Good morning and welcome. I'm Sandy Sharon, Senior Vice President and Area Manager for Kaiser Permanente Sacramento Medical Center.
And I'm Rob Azevedo, the Physician-in-Chief and Chief of Staff here at the Sacramento Medical Center.
Today, Dr. Azevedo and I are very proud to be standing in front of our new expanded emergency department. And just like everything else in 2020, this ribbon cutting ceremony is a little bit different than those we have held in the past. Typically, we would all be gathered together in person, celebrating the latest addition to our medical center and personally thanking the countless number of people who have made this day possible. But instead, we want to thank you for joining us virtually and most importantly, safely, for our live stream celebration. We especially want to virtually welcome those from our regional offices in Oakland, elected officials from throughout Sacramento, and most importantly, our physicians and staff here at our Sacramento Medical Center, who starting this week will begin providing high-quality, compassionate care in our expanded emergency department. We are also very proud to be holding this celebration a full 2 months ahead of schedule. Healthcare construction and ahead of schedule don't typically go together, but I think that we can all agree that during these uncertain times, it's more important than ever to be prepared. And we at Kaiser Permanente have demonstrated that throughout the past few months in many ways, and I'm especially proud that one of the ways we have demonstrated our preparedness is by speeding up our construction timeline so that the community can benefit from this additional resource.
I couldn't agree more, Sandy. When COVID-19 hit, of course, we were 5 months into building this new facility, and it quickly became clear that we needed to move our timeline up given what was going on around us. So our construction partners worked with our clinical teams and really created miracles to get this done, as Sandy said, 2 months ahead of schedule. We also want to thank both local and state officials around licensing and accreditation, et cetera, for helping us move things forward quickly. And as a result, we now have a state-of-the-art, beautiful expanded emergency department available to meet the demands for our patients for months and years to come. We're going to take you on a tour in just a few moments, but first, let me just give you a few of the highlights. So the facility itself is right at about 11,700 square feet, truly a state-of-the-art emergency department, and it includes 23 emergency beds in private rooms, bringing our total to 59 beds. We also have a 2,400 square foot walkway from the current emergency department to the new emergency department, and in reality, it almost doubles the space that we have. And certainly something that we have needed for a long time. We're one of the busiest emergency departments in Northern California. Last year we saw just about 115,000 patients through this emergency room. A little bit more about the rooms themselves. So each room has a sliding door for privacy, and there are specific rooms dedicated for children, for people who may have an infectious process, and even for people who might have special needs. The expansion itself has 3 separate nursing stations, and of course each of the nursing stations are up to date, most technologically enabled, and it really allows the nurses to also have line of sight with their patients as they continue to care for them. So also on the tour, you're going to see amazing artwork throughout, and really this was selected specifically to create an environment that promotes healing and calmness. So none of this could obviously have been possible without the help and dedication of some incredible people in the emergency department. Their expertise and guidance has really ensured that this expansion was built to meet our patients' medical needs as well as their emotional needs. And truly, they are the experts on caring for people in a stressful circumstance, and they can provide this care with skill and compassion. They are the heart and soul of our emergency department, and we're very proud of the work that they do every single day. So while there are too many people to thank in general, because there are a lot of people that help this come to fruition. I do want to just call out a few people specifically. First is Dr. Rick Vittangle. Rick is one of our APICs, and he oversees the emergency department with Hillary Mitchell, who's one of our associate medical group administrators. And the two of them work closely with the ED department leadership, Dr. Vin Lay, our chief of emergency department, and Brandy Cherry, who is our director. And really the four of them have been working to really lead this effort. And of course, I want to thank TPMG regional leadership for all the support that you have shown throughout this process. Andy?
Thanks, Dr. Azevedo. I too would like to recognize a few from our Northern California Kaiser Foundation hospitals and health plan and thank them for their support. These include Tom Hannenberg, Interim Regional President, Michelle Gaskell-Hames, Senior Vice President, Hospital and Health Plan Operations, Kevin Hart, Senior Vice President of Strategic Development and Technology, Mark Tortorich, Vice President of Service Delivery, and our entire local National Facility Services Capital Project team, headed up by their manager, Kirsten Damiano. I also want to thank our general contractor, Swinnerton, and our architect, the firm of Hibser Yamauchi, who both did an outstanding job. Through their work on this project, they and many others have contributed to the long legacy of high-quality, compassionate care delivered here at our Sacramento Medical Center. From the time we started providing care at this facility 55 years ago to today, our commitment to improving the health of our members and the communities we serve has never wavered. Today, our emergency department expansion is added to a medical center that is already home to the largest and most comprehensive neuroscience center in the region, a comprehensive cancer center, and a Joint Commission designated Advanced Comprehensive Stroke Center. The care we provide here has become well known for outstanding outcomes for our patients, and we could not be prouder to add this new expansion to our Sacramento Medical Center and our community.
Thanks, Andy. And we hope that you will all spend a few more minutes with us to go on the tour of this incredible facility. And we'll start that in just a moment. Along the way, you're going to meet some of the people that have really been involved in bringing this to fruition and really helping us to look at how we better care for our patients in this new facility.
We are immensely proud of our physicians and staff who strive each day to provide the best care for our members. Every patient, every time. We hope you enjoyed the tour, and we want to thank you for joining us this morning. So now, please celebrate with us as Dr. Azevedo and I cut the ribbon on our new expanded emergency department at our Sacramento Medical Center.
All right.
All right, Rob, let's have a countdown.
Okay.
Okay. 3, 2,
2, 1.
1.
Okay, Sandy. I got the least sharp scissors.
I think you did. I think you got a dull pair.
Maybe I can borrow yours. There we go.
All right.
All right.
Come on in.
Come on in. Wow, we're in our beautiful new emergency department, one of our hallways, and here to talk with Dr. Rick Vittangle, one of our assistant physicians in the chief who oversees the ED. How are you doing, Dr. Vittangle?
Hello, Dr. Azevedo. Good to see you.
Beautiful space. Can you tell us a bit about it?
You know, we're super excited to open up the emergency room expansion. We're getting 23 new private treatment bays, which will expand our overall footprint to double its capacity. We actually will have now 59 treatment bays. We'll be able to take care of patients of all ages, any type of emergency care that they might need in our community. You know, we're here to provide high quality service and high quality care, not only to treat their physical needs, but their emotional needs as well. You know, we've worked really hard to open up this new expansion 2 months early because, you know, quite frankly, we have our winter coming and we need to be prepared.
Great. Well, it certainly is beautiful. Thanks, Rick. And I'm going to turn it over to Sandy, who's outside of one of our new procedure rooms.
Thanks, Rob. I'm here with Dr. Vin Lay, our chief of the emergency department, in one of our new beautiful treatment rooms. And Dr. Lay, I think all of us fear having a medical emergency, and so coming to the emergency department is not something we all want to do. But can you share with us how this new environment affect the way our patients feel about coming to the emergency department?
Absolutely. If you look around here, we have 23 new beds with sliding door. We'll be able to give our patients the isolation and the privacy that they deserve. Out in the hallway, we have more space so that we can actually include family members in sicker patients' care. At the same time, we can also observe social distancing. So it's an amazing space, it's quiet, communication will be better among staff and physicians. Also, it's going to be a better milieu for patients to start the healing process.
So it sounds like it's going to be a great experience for our patients, and yourself as an experienced ED doc, how do you think this new environment is going to affect your practice?
Well, I've been in this ED for more than a decade, and we pride ourselves on efficiency, quality, despite not having enough space. This space will now allow us to focus more on the patient care experience. This is where patient care begins for most patients. They come to the ED when they're sick. The acute care process begins here, some of whom actually will be admitted to hospital, and the healing process start here as well. And their overall experience will be shaped by how they perceive their care in the emergency room initially. So this will add so much to that care experience.
Thank you, Dr. Lay. Well, let's go back now to Dr. Azevedo, who's at the nursing station.
Thanks, Sandy. So now I'm here with Hillary Mitchell, one of our Associate Medical Group Administrators. And Hillary, you have a lot of experience working in an ED as well as overseeing it. Tell me what this means for patient care.
Well, as you can imagine, in the emergency department setting, one of the most important things is our ability to collaborate and work together. And so I'm here at one of the nurses' stations, which actually provides the care team the ability to oversee and have full line of sight of their patients while they're managing their care. It creates that patient-provider or patient-nurse connection that's so important to their experience. So we also have several touch points here in the expansion where providers or nurses can actually pull up the medical record for their patient while maintaining line of sight and staying connected, and then continue with their plan of care. So one of the other opportunities we have here in the extension is a physician workroom, which allows our physicians to collaborate with each other, have discussions with their peers, as well as engage with consultants who may come in to provide care to these patients in anticipation for their admission to the hospital or consultation for care after their treatment here in the ED.
Wow, that's great, Hillary. Such amazing innovation and collaboration in such a beautiful space. Thank you. So I'm going to turn it back over to you, Sandy, to share something very special with us.
That's right, Rob. I'm here with Brandy Cherry, who's our emergency department director, and she's played a large role in the design of this expansion and even down to selecting the artwork. We're standing in front of this beautiful mural that was created, and Brandy, can you share with us what went into your thought process for the selection of the art for this space?
Yes, thank you, Sandy. We're super excited to bring artwork to the Sacramento Emergency Department. We selected things that would bring a peace and calm to our patients. Things like rolling hills, flowing water, and expansive farmland that are all recognizable in the Sacramento area. The other thing is this beautiful mural that was created on site by a local artist, Mirren Conrad. It stands 17 feet wide, 8 feet tall, and it has a lot of local features such as the bridge that kind of signifies Sacramento's area. And we also wanted to bring in some themes around farm to fork and things that are healthy and healthy activities. The other feature on this mural is the beautiful butterfly that sits down in the corner of the mural. Children can stand in front of it, and it's interactive and they can sprout their wings. Also within the complex itself, we have 2 treatment rooms that are specific to pediatrics, and we used other design features with the art that would promote some well-being by offering some whimsical sort of features and bright colors. Another special room in the ED expansion is the isolation room. That room is a negative flow room, and it really provides us the best opportunity to provide care to patients that are infectious or potentially infectious. There's an ante room that's adjacent to that space. Nurses can go in and safely monitor the patient as well as provide care and ensure the highest level of safety for all people that are providing care, especially during the COVID pandemic. And another great thing is the opportunity to bring in one of our own.
I understand we've got a special guest star that's going to join us. James?
Hi.
Hi. I understand that 2 of your pieces were selected to be displayed in the emergency department. Can you share a little bit about those 2 pieces of work that you did and how you created them and why you chose them to be in the ED?
Well, the 2 pieces that I have, one is a black and white picture of the Tower Theater that's in the mural. And I feel really honored to be able to contribute such an iconic piece of Sacramento history to this project. The other piece is a very big tree from Easter Island. I was traveling and exploring the island, and as I was driving, this big tree came out of nowhere, and it had its own energy. It was massive, majestic. I wanted to capture a sense of that beauty and awe and share it with the emergency department.
And James, we want to thank you for sharing your artwork with all of our members and the staff and creating that same sense of calmness that you felt underneath that tree. And Brandy, thank you so much. In the design of this space, the selection of the artwork, you've created something wonderful for our members and for our staff. Thank you very much. And now back to you, Rob.
Thank you, Sandy. And we also want to thank all of you for joining us here today in our beautiful new emergency department expansion. We've been in this community for 55 years, and this is just another example of how we care for our members and the communities that we serve.
We hope you enjoyed the tour today. And remember, if you have an emergency, we're here for you.